inspect your colleague on stage.
Bismillahirrahmanirrahim. Name is Dr. Saad, and today we are presenting renal system examination. And here is Dr. Uzair, and we have Dr. Atif is a patient. So let's start the presentation. This is my group member. So we have these 4 steps in renal examination: inspection, palpation, percussion, auscultation. The physical examination, the renal system can affect many aspects of physical examination, but this may also be relatively normal even with significant disease. General appearance, advanced CKD is most likely to alter the general appearance. The patient may look unwell with pallor. The skin may have scratch marks from pruritus, and in severe cases there may be dryness. Myoclonic twitching or stereosis and marked uremia. The patient's skin may appear yellow, but this is a late feature. Eye cupping may occur. Breathlessness may represent fluid overload or hyperventilation due to metabolic acidosis. Hand. Examine the hand, look for pallor of the palmar creases suggestive of anemia. Inspect the nail, looking for murex lines, which may be a sign of hypoalbuminemia, nephrotic syndrome. Are the half and half lenses nails of C, K, D, proximal half white, distal half red or brown. Dialysis axis, examine the arm for an arteriovenous fistula. This will look like prominent blood vessel on the forearm or upper arm. There may be scars from previous fistula on either arm. A functioning fistula will have a readily palpable fluid thrill, a continuous buzzing feel, a tunnel. Venous axis catheter may be seen exiting the arterial chest wall. The line can be followed under the skin and then entering the interjugular vein. Face. Inspect the face or rashes which may indicate underlying connective tissue disease. The butterfly rash of systemic lupus erythematosus, for example, look for conjunctival pallor. As anemia is common in CKD. Assessment of fluid balance. An accurate check on fluid balance is critical to assessing renal disease and can be completed as a single sequence process. General appearance: does the patient look hypovolemic or fluid overloaded? Abdominal examination. Examination sequence: ask the patient to be flat with their arms by their side. Expose the abdomen fully down to the level of the anterior iliac spine. Inspection. Look for abdominal distension in the flanks, which may indicate ascites. A further marker of fluid overload are large polycystic kidneys. Look for operative scars such as those relating to renal transplant in the left or right iliac. Palpation. Palpation count. Kidney not palpable in normal adult. may be able to feel lower right kidney pole in very 10%. Percussion in auscultation. So now Dr. Uzair will show us that practically.
Assalamu alaikum. My name is Uzair and I will be as a final year student, and here I will be examining the patient for renal examination. So firstly, the first step is the introduction, and I will take some information. So what is your name? What's your age? What's your profession?
Student.
So I will be examining you for renal examination. I'll ask you some questions as well, and I'll examine you and palpate you, assess you, sedate you. So is there any problem with that? Will it be okay?
Yes.
So the first step in physical examination is inspection. So we'll inspect the patient. I'll inspect the patient for any general feature. For example, I'll look at him, I'll give him a look, and I'll see if there is any presence of any pallor. If there's pallor is present in anemia associated with chronic kidney disease, I will look for him for any breathing abnormality. For example, is present of hyperventilation, which is a feature of metabolic acidosis. Now, sir, please can you just put your hands out like that? Yes. So I will look at the hands for any bruising or any scratch mark which is present in pruritus. I will look specifically for the nails, because we've got two specific nail features which are known as the Muke lines and the Lindsay short nails, which are associated respectively with hypoalbuminemia. It is associated with chronic kidney disease. Apart from that, please put your hand in a vertical position. Yes, I will look for any mark of any arteriovenous fistula which is present in dialysis. If patient doesn't dialysis, will be present of arteriovenous fistula. I think please put your hand in this position. Here, I am looking if they are present of any flapping tremor or asterixis. Asterixis is mainly associated with liver disease, but there is a hepatorenal syndrome. So with that association, asterixis can be present here as well. I will look at the patient's face. I'll observe the face. I'll look for any presence of any conjunctival pallor, diarrhea, which again will be associated with anemia, which is associated with the chronic kidney disease. Apart from that, many renal diseases has got association with other diseases. For example, there is a SLE, systemic lupus erythematosus, is a autoimmune disease in which you've got a butterfly rash, and it also affects the kidney, causing glomerulonephritis. So we'll look here, and if there is no butterfly rash present, that will be negative for SLE. Apart from that, we'll look for any inflammation of eye. Now, why am I looking for any inflammation of eye? I'm looking for it for the presence of association of any systemic vasculitis, which also affects the kidney as well, causing glomerulonephritis. A perfect example is the Hinoch-Schönlein purpura, which is a systemic vasculitic disease. Now, coming to the physical examination portion of it, the first step that I will be doing will be palpation. So please lay down. So going for the whole abdominal examination, I specifically go for the renal palpation here, and just palpate for the kidney, because this is what I'll be exhibiting here today. Now, the first rule of abdominal percussion is that when you are using your fingers, try to use that middle area of your finger, don't use your tips, okay? Don't use your tips. So, now we know that where the kidney is, okay? It's in a flank area. I use two different techniques for my palpation here. The first one is I'm starting just lateral to umbilicus, and I'm checking it here, and again, don't use your tips. And day two, that we will use superficial as well as deep palpation here. And put your other hand, so just keep that kidney in place, and be cautious of one thing, that don't put a lot of pressure, because at times the kidney is tender and it can have the complication as well. So look out for that. Another one, can you please just roll up? Again, put the hand towards the back and percuss for the kidney. But again, don't put a lot of pressure on the patient's kidney and look out for any tenderness here. This is how we palpate our kidney. You just another thing that we use here specifically is we look for the costorenal angles from the behind. The costorenal angle is present between the 12th rib and the lumbar vertebrae, specifically at the back side. So we can also palpate for that, but for that the percussion is a much better option. So the second step that I'll go directly for here is the percussions. So I'll percuss with the costorenal angles, I'll percuss for the presence of any edema, and I'll percuss for the is there any ascites which is associated with many renal diseases. Lay down, please. Now patient lay down. I'm specifically going to go for the percussion to check for ascites. So for checking for ascites, the first step is that you're going to go in a very specific fashion, in a very specific pattern. So starting, you just go through the midline at the area of umbilicus downwards. And the moment where you feel the dullness is the point that is basically the urinary bladder. You come down to that. From this urinary bladder point, you're going to dial position upward at the kidney flank area. And if you see any dullness, or if you feel any dullness, that's the presence of fluid there, and that is the presence of ascites. But now, to confirm that ascites, what you do is you do the shifting dullness test. I'll tell the patient to just shift on that side, and I'm going to percuss again. Now, the area that was dull in firstly, and now if it is resonant, and the dullness shifted to the midline area, so this is known as shifting dullness, and which is a feature of ascites. Can you please? Now, another very important feature of that we use in percussion is what we check for edemas. The sacral edema at the very back, we percuss it as well to check for the presence of any sacral edema. The last step of our physical examination of our kidney is we look out for auscultation. So auscultation as a whole, if you abdomen, we'll have to do the all the quadrant of abdomen we'll have to check, but I'll specifically go for the renal. Please lay down. I'll specifically go for the renal auscultation, and that is that we just check it laterally and above the umbilicus, and we check for the renal artery and to hear for any renal bruit. So the presence of any renal bruit suggests the renal artery stenosis, and for that always remember when you are using it for the to hear the bruit, try to use the bell of the stethoscope instead of using the main areas. Remember lateral or above to the umbilicus. Lateral and above the umbilicus. So if you hear any bruit here, that will be the presence of renal artery stenosis or any associated condition that is affecting your renal artery. Please. Now I'll summarize my patient. So my patient, Atif, age 24, a student. I did his renal examination. Firstly I looked for his general examination. There were no sign of any para, there were no sign of any bruising or any other associated renal symptoms. Apart from that, on palpation there was no tenderness or any rigidity, something like that, and on percussion it was really normal, and when I was completed I could not find any bruits. So my patient is absolutely normal, and that is my summary and presentation of the renal system.